And I am here now with local veterinarian Dr. David Linzey, and we're going to be talking with him today a little bit about stem cell therapy. Now, this sounds like kind of a complicated thing, maybe.
Kinda. It's a fairly new procedure that is kind of fun for us because it's one of the very few things that I know of that most of the time with veterinary medicine we usually adapt procedures and medications and things that have been used in people for quite a long time.
Okay.
And this is one of the first instances that I can recall where actually it's become available for dogs and cats, our pets, and not widely available for people yet, but probably in the future. I think that's probably going to be something that is going to be more widely available for people with similar situations. But this is kind of a unique procedure that we perform at our clinic. I believe we're the only hospital in the western part of the state, probably west of Charlotte, that offers this particular procedure. And it's fairly new. I consider it to be kind of a cutting edge sort of thing. But it is applicable for a variety of different procedures. Particularly, we're using it now with mostly dogs that are having, older dogs that are having some arthritis problems and some stiffness and joint hip dysplasia, things like that, that larger breed, older dogs tend to suffer from as they age. Typically, we treat this usually with various medications like glucosamines and anti-inflammatory medications and painkillers and things like that. This is a different approach and a different way to treat some of those same conditions, but it's considered to be kind of all natural. So a lot of owners are either the dogs may not tolerate these medications very well, or the owners are really wanting to get them off of some of these medications so that they don't have to be on some of these that do have some side effects long term. So the procedure itself is described kind of in a nutshell. Our medical trivia for the day is that, Danielle, you probably didn't know that there are a lot of stem cells stored in our fat.
I did not know that.
So some of us have more stem cells than others, I like to tell people. And when we talk about stem cells, people get very nervous because of the ethical concerns with those. These are completely different. The cells that we're using are actually in our fatty tissue.
Okay.
And the cells that we're using are actually belong to the patient to begin with. So basically we're just modifying them in such a way that we can get a more efficient use of them. So our fatty tissue has quite a large population or supply of stem cells, and we're constantly releasing small numbers of these stem cells all the time, and they're basically considered, the best way to describe them is like a repair sort of cell. So they're very generic cells that can turn into a variety of different types of cells and tissues and different parts of the body. In some situations, organs and things like that, but this is a little bit more advanced than what we do. But the body normally releases these in very small quantities, just all the time, 24 hours a day. They're constantly looking for areas of tissue damage or inflammation or injury, things like that, and they help to repair some of these tissues. So what we do with this procedure is we remove a small amount of fatty tissue, and we treat the tissue in such a way that we separate the stem cells from all the fatty tissue that they're contained in, and concentrate them and purify them into a concentration, and then we use that concentrated stem cell suspension to inject actually into some of the problem areas, which can be joints usually, and then we also give a supply of them intravenously at the same time. This all happens on the same day, so that's a recent advance. There have been other companies that have offered this procedure, but you collect the tissue on one day, send it off to the lab, and have them handled and processed at another lab, and then send them back and have the treatment done on a separate day.
Okay.
And this procedure allows us to do all of this in our clinic. So we get the patients in the morning, we do the collection. It takes about 3 hours to process the cells, and there's about 30 steps, and it involves some filtration, some enzyme digestion, and some centrifugation. And this is all done at body temperature because these are all living cells. And at the end of that 3 hour time, we have basically a concentrated stem cell suspension that we use to treat the patient that early, usually early in the afternoon. So instead of your body having this very slow, gradual release of these stem cells, we're basically flooding the body with a large number of these cells. And particularly if we can put them directly where we like them to go, which in a lot of these situations is joints, it's fairly easy to inject that suspension directly into the joint where we want it to have some effect. And our hope is that these generic stem cells turn into a variety of different types of tissues that'll help with pain, stiffness, those kind of things that dogs particularly suffer from with arthritis. So those cells turn into things like cartilage tissue and joint fluid and joint tissue and things like that to help make them a little bit more comfortable. But that's the process. After we finish all this, we actually ship the remaining cells that are left over to a lab, and they store them for us at liquid nitrogen temperatures, very, very cold. And they actually store those cells basically forever. If or when the dog needs a retreatment at some point in the future, then instead of having to go through the whole collection process, we just call up the lab and have them ship us a sample of that dog's cells, and then we can do the retreatment again. We've been doing this for about 2.5 years, and probably have about 40, somewhere around 40 patients that have undergone the procedure with very good results. I think every single one across the board really have had varying degrees of improvement, but the owners have been very happy with the, with the procedure and glad that they went through with it. And we're just now, since we've been doing this for a couple of years, are just now starting to get some of the early ones that we did initially starting to come back for retreatments. It's something that needs a touch-up from time to time, so it's not a one-time thing that takes care of the dog for the rest of the life, but oftentimes it's something that needs to be repeated at some point down the road, depending on how old the dog is and what kind of condition we're treating and things like that. I think this whole procedure and everything, and it has a lot of potential in the future for treating a variety of other diseases that, at this point in time, we either can't treat or have a really hard time managing or treating. So, and that can range anywhere from diabetes to potentially some types of cancers down the road. And I think that's where a lot of the interest in human medicine is going to branch off of kind of what we're learning with dogs and cats now. So
very neat. Now, when you explain it, it doesn't sound quite as scary, but do you have pet owners who come in and they're a little nervous about you doing this procedure?
Most of these dogs, primarily that we do this on, are elderly, mostly because those are the guys that are having most problems with the arthritis. So their big concern or hesitancy really is the anesthesia that they have to undergo in order to do the fatty tissue collection. Usually it's not a huge concern because part of the whole procedure involves a really, really extensive workup to make sure that they're healthy and there's not anything going on with them that we aren't aware of, because we don't want the stem cells to potentially cause a problem with an underlying infection, cancer, or something like that might be going on, which at this time right now, the procedure is not indicated for those sort of procedures, but I think down the road it may be. But by the time we get to the point where we determine that they're a good candidate, they've had an exhaustive physical exam, and we've really gone over them from head to toe and make sure that everything seems to be healthy. And occasionally we stumble across a medical problem that a patient may have that might disqualify them from being a stem cell candidate. But in the meantime, we discovered maybe a medical problem early that maybe the owners weren't aware of at that time. So either way, it's a good way to screen them, make sure that they're healthy, and in the process of making sure that they're a good candidate. So.
Okay, so there's a lot of stuff that you do beforehand to make sure.
There's a lot of prep work.
Good idea. Sounds good, sounds good. Now, what are some of the main benefits of doing this as opposed to other types of medicine?
Well, the main benefit, and particularly a lot of owners are concerned about keeping their pets on long-term medications, which mostly are minimal side effects, but some dogs just don't tolerate them very well, so it may not even be an option for them. But for the most part, the main reason is just to try a different approach to try to get some of these problems treated. Owners have been really overwhelmingly very happy with the results, and a lot of that just transforms into happier, more comfortable pets that maybe before had a hard time going up steps or jumping into the vehicle, or just mobility issues and things like that. And really, some of the changes have been dramatic. One of our technicians at our office was the very first procedure that we did several years ago. And her dog has done almost better than any of the other ones we've done since then. But it was a good one to start with because it gave us a really, really impressive result. But the end result is hopefully more comfortable, happier pets as they age, with the benefit of not actually being on combinations of medications or some medications that may have some undesirable side effects. So.
Very neat. Well, this sounds like a very cool procedure. Technology has come a long, long way.
It has a long way.
Fantastic. Well, one last question for you. Heading into spring, it is officially spring. We have all the pollen and all that good stuff
That's what
coming
they
around.
tell me.
Yes, my nose does not care for it at all.
Yeah.
Any tips for caring for our dogs as we move into a new season?
Yeah, we're starting to, just in the last couple of weeks, starting to see a lot of dogs having some allergy issues,
Right.
as are some people. And a lot of times the triggers for that are the same for people and dogs.
Right.
People usually get the kind of runny eye, sinus drainage, those kind of things. Dogs get very itchy, and they can have a lot of ear problems.
Right.
Skin itchiness, foot chewing, hot spot issues, and things like that. And those are all starting to appear. And along with that comes flea and tick season,
Yes.
which will be here soon. And we'll see how this past winter has affected that season this year. Hopefully it'll make it a little less severe. But all those things that tends to make dogs itch are upon us. And as things start to bloom and things start to turn green, it's that time of year. And but a lot of pets require some medication, shampoos, those kind of things to help manage those kind of things. But it's coming. So
Yes, lots of things to think about when you have a pet.
there are.
Now, remind us one more time where you are located and what your hours are in case any of our viewers have a need.
Sure. Our hospital's on Highway 105, right across from the old High Country Inn down there in Gino's and Sunrise Grill. And we're open 24 hours a day, so there's always somebody there at the hospital. We see emergencies 24 hours a day, both day and night, and then have a regular office hours scheduled between about 8 and 6 during the weekdays. So always somebody
Sounds
there,
great.
and can offer a variety of different procedures and things. So.
Sounds great. Well, thank you so much for coming in,
Right.
and we will look forward to talking with you next month here on the show. And we'll be back right after these messages with more of the Mountain Television Network.